So, a very good day to one and all. I am Dr. Rohit and today we will be discussing about stomach. So, in this particular class, we will be discussing about stomach, its embryology, its relevant surgical anatomy and the physiological processes that occur within the stomach. So, going on to the embryology of the stomach. Now, we know that the stomach develops from the foregut, which itself is a portion of your linear tubular gut. Now, the foregut actually develops a small distension which later forms the stomach. So, this appearance of the distension occurs by around the 5th week of gestation. As this distension occurs, you find that the stomach tends to develop two surfaces and two sides. So, the stomach tends to develop a ventral surface which is anteriorly placed, a dorsal surface which is posteriorly placed, and has a left and a right side to it. Okay. Now, the ventral surface is attached by means of a fold of peritoneum to the parietus by what is called as which later forms the ventral mesogastrium. Posteriorly, the stomach, that is the dorsal surface or the posterior surface of the stomach, is attached to the retroperitoneum by means of a fold of peritoneum, which would later become the dorsal mesogastrium. The ventral mesogastrium, we all know, is closely related to the liver and the diaphragm. So, the portion of the ventral mesogastrium, which is between the stomach and the liver, forms what is called as the lesser omentum. Okay, whereas the portion between the liver and the diaphragm forms the coronary ligaments and the falciform ligaments. Now, the dorsal mesogastrium, which extends from the posterior surface of the developing stomach right up till the retroperitoneum, again is divided into two parts by the developing spleen. So, the portion of the spleen between, or portion of the dorsal mesogastrium between the spleen and the stomach forms the gastrosplenic ligament, whereas the portion of the dorsal mesogastrium between the spleen and the retroperitoneum forms the lienorenal ligament. Okay. Now, so these are the relations of the stomach when it is upright in this particular stage. So, in this particular stage, you find that the two vagi which are going to supply or which are supplying the stomach are on the right and on the left side. Okay, so this is a better image which is showing us the dorsal mesogastrium on the posterior aspect of the stomach and the ventral mesogastrium arising from the anterior aspect of the stomach and the two vagi in relation to the two sides of the stomach. Then what happens is that the stomach undergoes a process of differential growth. That is, one side of the stomach grows more than the other. The stomach then undergoes a process of rotation and differential elongation. So, the rotation of the developing stomach can occur along two axes. It can occur along a longitudinal axis by around 90 degrees in the clockwise direction as shown here. The second rotation occurs along a transverse axis, which results in the orientation of the fundus in its normal position as we see in adults. So, because of these two changes that occur in the stomach, along with the process of differential elongation, wherein one wall of the stomach undergoes greater elongation than the other. So, you find that as a result of the rotation, the anterior surface of the stomach tends to come to the ventral surface of the stomach tends to come to the right side because of this rotation process, and the dorsal surface of the stomach, which is the posterior surface of the stomach, tends to come on the left side. Similarly, the vagus which occurs, the right vagus comes on to the posterior aspect and the left vagus comes to the anterior aspect. So, that is how it is in adults.